Can you elaborate what exactly medical affairs?
What digitalization has actually done is improve the access to information. And with so much information out there, for patients, for clinicians, right? It is very easy to become lost and you don't know which source to trust and which not.
Even if you put just a simple headache into Google or AI, it makes you end up having cancer out there. How can an inpatient really differentiate and understand this information correctly?
AI should be an enabler or a reference. It can never, replace the doctor.
I have few friends staying outside, and whenever they talk about visiting a doctor, it's probably 2 months or 3 months from the date they are having the actual problem.
In fact, the patients will have to go through their GPs and then they get an access to specialists.
Listeners, healthcare conversations today, have gotten more complicated and more aware with the advent of AI in our lives. And earlier we had Google where patients used to research and go to doctors and make their lives difficult. But now today we have AI as well. And to understand this intersection of AI, science, and communication, as well as responsible digital innovation, we are joined today by Dr. Aparajita. Hi, Dr. Aparajita. How are you?
Hello, hi Pulkit. Thank you so much for actually having me in this podcast. It's my pleasure and privilege to be here with you and to have this conversation. But at the very outset, I would like to tell you what we discuss here today is not medical advice. It is just from my experience, and it does not represent the views of any organization that I am and have been a part of. And I would really encourage all our listeners, in case you have any questions or anything you would like to discuss, it is always better to take that to your healthcare personals to have that discussion further. So this is
Absolutely.
not a medical advice.
Thanks a lot. Thanks a lot, Prajita. And, pleasure is all mine. Thanks a lot for accepting the request. I understand you are going through a lot of, tight schedule at the moment, but really, really
Not
appreciate
at
it.
all.
Thanks a lot.
Pleasure.
So Prajita, why don't we start with your introduction first, your journey so far, what different experiences you have had in the medical field. So why don't you share that with our listeners?
Absolutely. So presently, I am, as you mentioned, I'm working in the intersection of medical affairs. So I'm working in a pharma company called Bayer. It's a German pharma company, in fact, a multinational one. And I'm working in the intersection of medical affairs, digital strategy, helping to translate the evidence that we have through clinical trials into meaningful clinician conversations. And that is what the major job of medical affairs is. Along with that, I'm also, I help in building scalable, compliant, digital ways to support HCP learning. And there have been certain projects that I have been a part of which has primarily worked in this regard. uh, that is in short about me. At present, I've been in the pharma for now close to 3.5 years. But having seen this side of things, I'm actually coming from the opposite side of the table. So, from a clinician perspective, I have been working in the academics. So, I'm an oral medicine and radiology, specialist by my background. And the initial 10 12 years, more than a decade of my life, I have been working as, a clinician. I have been working, in the academics as well. And then, as fate would have it, 3 years back, I transitioned into pharma. So, in fact, I would say that it gives me a very diverse experience and perspective in terms of how things stand from a clinician point of view, and now how things stand from the pharma perspective. And of course, I think we are all uh, individuals for whom health is important in a personal level. So yes, I can be a patient, I can speak from a patient's perspective, so that gives me a more of a holistic view about this, the entire healthcare system and setup.
Amazing, amazing. That's really a plush experience that you bring today, to for our listeners. Aprajita, you mentioned about medical affairs. Can we discuss a bit around that? Can you elaborate what exactly medical affairs, contain and how it is relevant in today's time?
Absolutely. So let's divide, like, I think the healthcare system into two parts. One would be pre-COVID, and then we have the post-COVID. One major thing which changed post-COVID was the digitalization. So it was happening since a very long time. But post-COVID, things, became quite accelerated, right? So when we are talking about healthcare systems, patients, clinicians, hospitals, pharma, they're all different, branches, or let's say aspects or parts of healthcare system. And the digitalization that we have seen has affected all of these four, branches. What digitalization has actually done is improve the access to information. And with so much information out there, for patients, for clinicians, right, it is very easy to become lost, in that whole sea and ocean of, all that data and information out there. And you don't know which source to trust and which not. Primarily, I would say, even when we are coming to digital, it's also the social media which has a role to play over here, right? With so many influencers, self proclaimed healers, and medical experts, it's very difficult to filter what is the truth, what is authentic from the jargon. And this is where medical affairs comes into the picture. So a pharma company, let's not only talk, not only pharma companies, but otherwise there are organizations, institutions which are doing clinical trials, right? Even the duration of the clinical trials have really, become quite short.
Yep.
So there's a lot more data which is being, generated. And all of that data doesn't really reach from the, from the bench, that is from the, from the labs to the bedside, to the clinicians in, proper or right time. So it takes a very long time for that data to be filtered and brought into the clinician practice. Earlier, it used to be decades. Now, the time has come down, like the duration has come down. It might be probably 4 or 5 years, but it still takes a lot of time.
Mhm, mhm.
Medical affairs helps in bridging that gap. So, from a medical perspective, medical affairs perspective, we help in translating that clinical trial data or that evidence, make it a lot more simplified for the clinicians to be able to digest that, to be able to understand what that data is like. We also help them in actually designing certain clinical trials.
Mhm.
So there are clinical trials which are like phase three clinical trials, like really multinational global clinical trials, and there are also investigator initiated studies,
Okay.
right? Which would be more localized, more regional, and more specific to the population in that region.
Mhm, mhm.
So we also help clinicians in designing those trials so that they are able to generate the evidence which would be helpful for the population in that specific region. Apart from that, there are also guidelines which are being generated, like, almost annually you have guidelines being created which helps in simplifying the overall, patient treatment process or decision making, process. So this is also where we help the clinicians, be able to make those decisions or take those decisions in kind of filtering out those guidelines, helping them out. Now, apart from this, it is also very important. You see, medical field is evolving quite
Right.
rapidly now. And as I mentioned, bringing that evidence to a thought leader, basically the HCP, and then disseminating that to the masses, which would be like, the other doctors, and ensuring or enabling a peer-to-peer discussion, Because at this point, when you are in a clinical practice, besides the textbooks, besides the clinical trial data, it is very important to learn from, experience and each other's experience. So this is also somewhere where we help out, in having scientific, helping in, arranging, organizing scientific events, scientific, congresses, conferences, where they can take part and, have those continuing medical education dialogues and discussions. So medical affairs is basically a bridge between the labs in the clinical trials, like clinical trials labs, the data which is being generated, and, the clinician's practice. So we help in filtering, disseminating, getting that information. That is one aspect of it. There is another aspect where we are also helping out, in translating that information which we are sharing with the clinicians to be, for them to be able to better implement it in their practice for the patients. So this is where we are indirectly helping them, and that's a really important aspect of it. Getting, ensuring that that data and that information is actually helping the patients, and it's actually translating into, practice and better care and better, healthcare services for our patients.
I understand. I understand. I had the opportunity, to work with certain healthcare giants out there. And probably, if I have got the gist correctly, towards the later section that you mentioned, where it's going towards the end patient finally.
Absolutely.
So, if I remember I won't be taking the name of the brand out there, but yes, I was, asked to create a lot of content around hemophilia awareness. So
Hmm.
it was primarily done for tier two and tier three cities of India.
Yes.
And it was one of the Japanese healthcare giants for whom we were doing this. The content that came to me vis-a-vis the content that was finally produced for the end patient, that was totally poles apart. And that's where I really want to understand with the introduction of AI,
Yeah.
how easy it has become to disseminate that information to the end patient. Uh, at the same time, recognizing the leakages that are there, because even if you put just a simple headache into Google or AI, it makes you end up having cancer out there. So how
Absolutely.
can an end patient really differentiate and understand this information correctly?
Absolutely. Thank you so much, Pulkit, for actually asking me that question. That's a very, very important question and something which is close to my heart. So, in terms of AI should be an enabler or a reference. It can never, replace the doctor. So, just earlier today, I was reading an article. I think it has just been published by, it's a research by Cornell or Carnegie University. It's called No Harm. So, this research, what it was doing, it actually assessed the impact of AI and how accurate are these LLM models in comparison to, physicians and specialists. And one point is it's not only patients, it's also the clinicians these days who are depending upon LLM. Not going into the details of that study, what it basically said is LLMs are helpful. Yes, they are able to filter out the content, remove like most of the noise, but then they are also bound to hallucinations. The information, it doesn't have the acumen or the sense to assess what is right and what is wrong. It is basically filtering out content from, it is basically producing that material from all of the articles, the newsletters, all the material that is present or available on the web,
Yep.
right? And that is not authenticated, right? So you cannot dissuade, and it is not right because information is power, right? Unknown is fear. So
Yes.
in case I have, and this is what I mentioned, post-COVID things have changed. It's become more digital and more social media, heavy. If I have a symptom, if I'm not feeling good, I think the easiest thing I can do is just pick up my phone, type in, now earlier we had Google. It's Google is still a little difficult because you'll have to go through all of the sources. AI is so much more easier, right?
Yeah.
And much more relatable the way now it has been created. But the source is not authenticated. A single symptom is not diagnosis, right, Pulkit? A symptom is not diagnosis. A symptom is just, something which is telling you just a little about what is happening. Besides that, there is your history, your family history, how you respond to drugs. There's several other conditions also associated, which a doctor is in a better position to be able to make a sense of and give you a proper weighted advice. I'll not be asking you not to, refer to AI or Google. You must, because an informed patient or an informed individual is a partner in the healthcare journey. But take that with a pinch of salt. Do not entirely depend and rely on, these LLM models. There are certain models which are created very specifically for healthcare, for
Mhm.
clinicians. Their rates of accuracy are still better than what the common and the general LLMs are. But the point is, LLMs are good as a reference point, but they are also bound to, fallibility and error.
Yeah.
So you should not be entirely dependent on, those models and the systems. Another point is, if you, trust in healthcare, or, in a clinician and a patient relationship is really important. If you sometimes, you feel what the doctor is telling me is perhaps not right, and what I Googled seems to resonate better with me, or what I kind of, chat gpt, the advice chat gpt told gave me, or the advice some influencer gave me, that actually seems, so much correct because that resonates with my beliefs, right? And I should rather go with that. I mean, if you have that doubt, go and clear it. Have that conversation with your doctor. Ask him, this is what I came across, this is the information. Instead of acting upon it, have that conversation, an open conversation with your doctor. As I mentioned, I have 10, 12 years of clinician experience, and I can tell you from my experience, a doctor is only too happy and pleased to have a patient who understands and who already has that information to have that discussion. And that is how healthcare has also changed. Doctors are these days no longer just providers. They have
Mhm.
become more of your partners in the healthcare journey. And as patients also, that is what, you are. You're just not a receiver. You work with your doctors in order to arrive at your own, you know, your journey, your diagnosis, your management as such. So AI is important, an amazing invention. Google is also really good, but go with trusted sources. So there are um, certain websites, like NHS website is there, NICE guidelines are there. Then there is a Cochrane plain language summary. Those are like proper, authentic sources. You should, I mean, if you really want to know, those are the, some of the sources that you can actually refer and understand than, going to some Instagram influencer, or depending upon, say, Instagram influencers advice, or just Googling and using AI. Even with AI, you can ask the AI to choose the source from PubMed published articles and also provide reference to what it is saying. That way, you know, you can then go back and you can go and check the reference that the AI is actually, referring to in order to provide you with that answer. So don't be dependent, work with AI. So it has to be like a human AI partnership. Applies to clinicians, applies to patients, I think applies to all of us. And that should be, what the future should look like. Like not AI alone. It has to be human judgment and AI collaboration and partnership.
I totally agree. And thanks for sharing these websites as well as bringing out the point how human AI partnership is really important.
Yeah.
And you also touched upon a very important point about trust between the clinician as well as the patient. So I would like to discuss one point on this, and you can refrain from answering if it gets too controversial over here. Uh, there's a lot of negative breeze being going around the medical industry when it comes to the clinician's end. And since you have been in a doctor's seat out there, I definitely understand the lack of doctors in comparison to the number of patients that are out there, the lack of time that's out there. But often, the notion that's now coming out amongst patients with different experiences, even I have had with different hospitals, it has become more of a business. And as you rightly pointed out, trust is the main factor. So one point comes in, like I have two, three parts to this question. One is about the trust. How do I trust somebody who is not even listening out completely to me? They are just probably, I was talking to a mental health expert, and she mentioned that the expert was taking like around 5 sessions in 1 hour, 15 minutes, 15 minutes slot each. And somebody going through mental health, I can't fathom that you are just giving 15 minutes by the clock to a mental health patient. You're not listening out completely, you're not understanding the symptoms correctly. How can you be trusted on that aspect? So I know it's very highly subjective. The width horizon is very wide over here. But what are your thoughts on this?
But actually, what you have touched upon is really important and very relevant. But I would like to give you a very, let me say, a generalized view of this, right? As a patient, you would find a doctor is probably not giving you as much time. As a doctor, I would see there are 25 patients that I have to see within, let's say, an hour, hour and a half, right? I personally, and that happened. That happens
Yep,
very,
totally.
frequently. So I did my MDS from Government Dental College, Mumbai. And Mumbai has only, I think, one or two government colleges, right? I mean, hospital colleges, dental colleges. One would be GDC, and one is probably, let's say, Nair, but Nair is more of like a private and government partnership, if I'm not wrong. The amount of patients we would get, the entire corridor, I think a daily OPD would run close to 300. That is how it would be every day, 300 patients, right? And um, there are just around, let's say, five or six, doctors who are doing the OPD. Then we send them to the specialists. So for six, I think it would be 50 or 60 odd patients that I'm seeing every day. For me, every patient is important because I don't know, like, there might be that patient who requires my specific advice today because maybe he's coming from 50 miles away or 60 miles away and he cannot come again after, maybe he can only come and visit me after 3 months.
Absolutely.
So I think the best possible solution for me would be to listen to you, give you the best possible diagnosis I can within the limited period of time that I is, available to me. I'm also human. I cannot work for like, 20, 25 hours on and I mean on and on forever. That is one aspect, and it is the truth. That is maybe, where our healthcare system really needs to evolve. We need to have more number of doctors for the patients in order to provide them with the time and the quality of care that we would like to provide. Earlier, if you consider it from, how things were earlier, I understand, doctors took their time in order to understand the patient. Again, because for them, that oral diagnosis, like in the sense, your history, what you are saying or what you're telling me, my physical examination of you was more important because I did not have any other tools. I did not have an X-ray. X-ray was not as easily available. I did not have CTs. I did not have MRIs. So I had to entirely depend upon that conversation I was having with you. I needed that time. Right now, primarily, maybe I can have that discussion with you for 5 or 10 minutes, and then I can send you, uh, get some other tests and diagnosis done, and which would provide me a more objective, I would say, data to help me derive that diagnosis or arrive at that diagnosis, right? Earlier, it was more subjective around my perception of your symptoms and signs.
Yep.
In a way, that is good. That is enabling me to see 25 patients where I could have only seen 5 patients, right? So I'm providing my care to 25 patients. Yes. But I also understand from a patient's perspective that relationship with the doctor is really important. Things have changed, I would say, even from a patient point of view. Earlier, if you remember, I think your parents, your grandparents, they had that one family doctor who would take
Yep.
care of everything, right? These days, even patients are shopping for doctors.
Mhm.
You go to one doctor, you're like, oh, this doctor is a little expensive. Let me go to this other doctor. And then you go to, oh, I don't trust this doctor. Let me go to this other, the third doctor, right? There is a breakdown of that relationship and that trust between a patient and a doctor. There are things which have become commercialized, yes, but that, I would say, it's a two-edged sword, you know? It's not all bad. It's
I
definitely not all good. Why not? You need that money for that care. If you want that personalized care, you want to live like, see, for example, hospitals, let's say, where the cost of treatment is much lower. The facilities you will be getting there will also not be up to the mark because, of the lack of resources. And there are, on the other hand, I wouldn't say the quality of doctors, it's amazing. But we agree, there are hospitals which have lower facilities, there are hospitals which have those high end facilities. For them to be able to run those facilities, they need that money. For them to be able to provide you with those specialists, like, the top notch specialists, the doctors who are getting trained and, were coming back from, let's say, with fellowships from US, with the training from the latest medical advances. In order to afford those doctors, these hospitals will have to, be able to cater to that expertise. So
Yep.
they are providing you with that level of medical, you know uh, I'd say, the overall experience as well.
Yes.
So yes, it can get a bit commercial, but again, I would say it's a very thin line. Sometimes there are, dishonest establishments, there are dishonest people, and there are honest people. You should not be clubbing them all together in a single category. I think that is where you need to have that discernment and you need to have that understanding as well, right? Like, what is money would be required. It cannot be absolutely selfless until the government entirely sponsors and supports it, right? So
I
I think the system needs an overhauling. The system needs a bit of a change, like just, continuing a little more. Like, for example, in US, UK, you have an insurance system or insurance policies, right? All the hospitals are tied to those insurance systems, which makes out of pocket expenditure really low for the patients. And that is what enables the hospitals to provide, that quality of care to the patients without patients really having to worry about, the out of pocket expenditure. This is not the case here in India, where mostly the healthcare system, is entirely based upon out of pocket expenditure, which can at times create a little complications.
But again, there's a different aspect as well, Aparajita, over here, where accessibility over in the international countries to doctors, I
Yes.
believe if you remove the financial aspect of it, is a bit difficult. I have few friends staying outside, and whenever they talk about visiting a doctor, it's probably 2 months or 3 months from the date they are having the actual problem. Whereas in India, if I have any issue, I can just go and visit a doctor in 5 minutes.
Absolutely, absolutely. In
So
fact, abroad, in fact, the patients will have to go through their GPs and then they get an access to specialists. In India, if you feel I need a specialist care, you go directly to the doctor's door, you knock on the door, and you have a proper specialist care and an emergency service, let it be whatever be it, you have it right on time, it would be there. So, well, that's what I'm saying. There are good points, there are certain disadvantages of the system.
yep. There is always going to be things there, you need to work upon. There's nothing called as a perfect system out there.
Absolutely, absolutely. Rightly said.
Getting back onto the point of communication dissemination out there. So while I was working with some of the healthcare companies, as I shared earlier, one of the processes we were working on was bariatric surgery. And this is using bariatric surgery only, I would like to frame my question around is after the bariatric surgery is done, there's a lot of deficiency that occurs in the body in
Yeah.
terms of the vitamins and supplements, the patient has to, after the surgery, they have to take. Now,
Yes.
how can a patient ensure, while at times doctors do communicate, there is always a communication gap that comes in, or the filtering in communication that happens, that how much is a patient able to understand? The doctor might communicate, but the patient is not able to understand. So, how can a patient take a very informed decision?
So, Pulkit, I will not frame my answer just very specific on bariatric surgery over here, but in general, in terms of communication.
Yep.
And this is really important, what we alluded to previously, right? That the communication time between a patient and the doctor has actually come down quite a bit. A doctor is not able to devote, maybe 20, 25, 30 minutes as I think previously was the situation. So for a patient, in order to get all of that information is really difficult. What I was discussing with you previously, regarding the digital sources of information, this is what becomes really important. As a patient, what I'll do is I'll probably start Googling. I'll start, trying to, you know, get my information from social media in a way that's very relatable. And that is something, which is within our comfort zone. But that is not the right source of information over here. First and foremost would be if you have any questions, maybe you cannot expect the doctor to provide you all that information, right? But if you have any questions, you can go and ask the doctor the pointed questions. He is actually or your first and foremost and the most important source of information out there. And he should be your most important source of information out there, like a reference point. So, any questions you have, first go and talk with your doctor. Ask him. A doctor is actually always accessible if you ask him questions. He might not be able to give you the entire list of things, he might not be able to explain everything to you, but if you have a question, go ask him. He will definitely provide you with the, right answer or the right advice. The second, which I mentioned, and please don't consider it as an alternate to medical advice. Medical advice is the only most important thing and the only source that you should depend upon. But then you have, as I mentioned, these Cochrane, and I'll probably provide you with a list of, some of these, sites which can help a patient navigate, his or her, and should be able to, like, access authentic information. You can access clinical, journals, articles, and they're available to that's freely available on the site. You should just know the sources. You have PubMed referenced articles, right? uh, those are primarily the ones you should, mostly be referring to. There are certain government sites as well, right? You have our own Indian government sites. As I mentioned, you have, if you want, NHS sites are there, then CDH sites are there. There are, as I mentioned, Cochrane plain language summaries for the patients. That can be your second source. And I'll provide you with a list of some of them which I have right now, which you can probably share with your viewers. So these can be some of the sources that you can go to just for reference and for that initial information which you can go and have a discussion upon with your doctor or healthcare provider. Third would be there are a lot of patient advocacy groups and patient support groups as well out there. And these patient support groups are, and that would obviously depend upon the situation and the condition that you're going through. Like, for example, for heart failure, if it's case of, some cardiac issues, you have the Heart Health Foundation. In case it's situation of you're suffering from some form of cancer, maybe lung cancer or prostate cancer, whatever, then there are certain other organizations which are there, right? So you have these patient advocate groups, you have these patient support groups and organizations, which and they are actually a very important bridging group between the clinicians and the patients. They're generally made of, there are doctors who are part of these groups. There are patients who have experienced it themselves who are part of these groups. In India, we generally, I don't think there's a culture around this. We are not really actively seeking help from these support groups, but they are there and they can be really important. I mean, they can be really helpful in your journey and definitely a lot more helpful than the influences that you commonly see on social media. They are more accessible. Yes, the influencers are more accessible, but they might not be like are more reliable than these patient support groups. So,
Yeah.
well, I can help, provide certain names if, anybody wants to probably go and take a look. But then I might not be able to provide you with an exhaustive list at this moment. It has to, it depends from person to person, what your condition is. Right? There can be a person is suffering from, like, there are several conditions out there, and similarly there'll be several support groups. And basically some of these support groups, they are global in nature, and these support groups also have their websites and patient aids that people can go and
Mhm.
kind of uh, read and learn and know more about. And then you have these contact groups as well with whom you can kind of interact and understand. So yeah, these are some
Understood.
of the sources that you can actually go and access.
So, Dr. Prajita, help me understand, your own journey. We have been discussing a lot about the industry in general, but let's also understand your journey from being a clinician to being part of the, circle that's enabling these clinicians or acting as a catalyst for the practice of these clinicians. So, how was that journey for you?
I would say that journey as such has been interesting. Because coming from a clinician's point of view, you are only aware about, like, for you, what is important is your immediate surrounding, which would be your hospital or your clinic, and your patient and his journey. Basically, for most of the clinicians, that is what the focus is. Additionally, the focus would be in terms of my specialty, what are the advances? What more can I learn? And how, better will I be able to contribute to the overall management of my patient? Moving to the pharma now, it has somehow broadened my vision. It has given me a more, I would say, a holistic overview now. That relationship between a patient and a clinician is very important. But there is an ecosystem around it which is actually supporting that. That is the main job. Obviously, that's I would say, the fulcrum. or the, the most important, the point. But then there is this entire environment or the ecosystem around that is made up of, these pharma companies which are helping provide that drug or provide, those equipments, that I would say tool to the clinician to be able to do their job properly. You have the hospitals and the entire healthcare system, the organization, which is in turn again, collaborating with the pharma companies, collaborating with, obviously the government, the policymakers, in order to create an environment where a clinician is able to do his job properly. These, elements of that ecosystem is really important. Then you have, the societies, which have, like, let's say, for example, the ADA Society, the American Diabetes Association. So these are like that educational society again, which helps in, gathering that data, the evidence which has been collected, filtering it, creating that guidance or the guidelines, which can again back to helping the clinician treat the patients better. So what, what has made me actually really appreciate and kind of understand this complex web of ecosystem, how all of these elements are really interdependent on each other. Like, they are not, I mean, one cannot exist without the other. I understand there is a lot of, I would say, misconception around some of these organizations, pharma companies, hospitals, even associations, and, these societies. There is also a lot of misconception about the clinicians and hospitals, but they all form a part of a very complex system, and nothing is black and white, like everything in life, right? It is actually,
Yep.
it's a very gray zone. You cannot really take one and say, oh, this is not good. This, it has its advantages, disadvantages, its elements which is beneficial, elements which are not. And it's just like any other system in the, healthcare system is just like any other system in our lives and in the world, right? You just have to, and it serves its purpose. It's still, it obviously it serves a very important purpose. It's still serving its purpose, and it will continue to do so regardless of any digital advance, any digital innovations. AI can never, I would say, and has made me realize and appreciate that a lot more right now. AI can never totally replace a doctor and a healthcare system. It will only be complementing it, and that is how it has to be. And I think now, moving away, I'm still a very, I'm still integrated in that, overall system, but it has given me a vantage point, kind of a view of how the system works. It makes me appreciate it a lot more, and there is just not one way you can come in, contribute to the healthcare system. There are a lot of ways you can do it. You yourself are actually contributing by enabling these conversations and helping patients access this information, right? I'm helping in my own way. And all of these points and components are really important. And I
Yep.
think, now having both of these perspectives, the clinician's perspective or the farmer perspective, has given me kind of this, help me appreciate this holistic, view of the overall system and organization.
Amazing. Any one particular anecdote from your journey that you like to share, that really helped you see that intersection where which you're enabling today, create its impact out there?
Actually, Pulkit, I cannot think about a single anecdote over here, but I can think about this past 3.5 years of my journey in the pharma, like in this intersection. I have had several really interesting, impactful conversations, and I have myself presented in, several, I would feel, impactful, scientific meetings and discourses. And I might not be the impact that I have created there might not be very palpable and very direct, but it is that very indirect effect I have had. I have had doctors call me, you know, in the middle of the night, and early in the morning, asking me about certain clinical trial. What was the effect? Can it be given to the patients? What is the evidence? They've called me, said, I have this patient right now. Can I do this? And I know when I'm giving them that information, like, that evidence backed data, which would be completely impartial. So it's entirely upon the clinician to take that judgment. But when I'm giving them that information, that evidence, I know that would be, that is making an impact in that on the patient's life. We have had certain situations, certain conditions where a patient was in a like not a very favorable situation, and a discussion or it's a scientific discussion with that doctor actually made an impact into the patient on the patient's life. And with the new intervention that that conversation brought forth, the patient's life was improved.
Oh,
So impact might not be in masses, but even making that difference in one patient's life is something, if simplifying a communication, if helping the doctor at the right time with the right information can make that difference, that itself, I would say, is like it's fulfilling and it's quite impactful for me.
I agree. I totally agree on that. Even, one single life saved is a very big thing out there, and it really creates an impact.
Yeah, I mean, it has an impact on the patients. You have family, you have friends, so you are not able to really realize, like from the outside, it's just a number, but for that one individual, it's his whole life.
So, Dr. Prajita, before we conclude, any final message you would like to give to our listeners?
The final message for me would be your healthcare provider, and I'm sorry to say the word provider. He's not a provider, he's a partner now, and HCP is no longer your provider. He's your partner. Make that person a partner in your healthcare journey. You have the tools available with you, really important and very powerful tools. You have Google, which maybe your parents, your grandparents didn't have. You have AI now, which for sure your parents didn't have. So you have all of this information on your fingertips. Use this information, use it responsibly. Do not just depend upon propagandas, hearsays. Your opinions need to be balanced. Develop that trust, that level of trust with your doctor within the healthcare system. They are your primary information providers. Make them your partners. Refer, of course, refer to Google, refer to AI, refer to all of those articles that and really authentic sources, reliable sources. Be responsible in your own healthcare journey, right? Be responsible, get that information, go have that discussion, develop a trusted relationship, get an holistic and overarching view instead of just depending upon one source. My one takeaway would be multiple sources. Go through multiple sources, go through reliable sources, and make your healthcare provider your partner in your journey.
Wow.
So,
I don't think so. I can, conclude it much better than you did. So thanks, Dr. Prajita, for helping me with the conclusion.
thank you.
And listeners, if you have any questions, we will be sharing Dr. Prajita's, contact details in the description. You can reach out to her. And until then, do remember we are your partners in your mental health journey as well. And you can share anything anonymously on our mental health platform called We Are Listening. Link would be in the description. Stay tuned. And until next time, remember, we are listening. Thanks.